I'm Kayvon Nikchu. I'm proud to be here. Tomorrowland is a dear place for me. I've been here 9 times. I was right about there on Sunday. It was great. So it's a fantastic opportunity to be here and actually do something useful. I'll be your host today, and we're going to be doing interesting things around innovation, health, and for general of humanity. No big deal, just like just a little bit of stuff. Today we explore how technology, especially AI, is changing healthcare and tech in general. It's about solving big problems and shaping our future while also tackling important ethical questions. We have 2 guests here on my left, Guy or Guy. What's the best way to say it?
Just Guy.
Because I think Belgium say Guy.
I know. I'm just Guy.
Just Guy.
Yeah.
From Amazon Web Services, who's building the future of health tech. And I'm wondering, we will actually probably do the same question. A lot of people are wondering, why is Amazon in healthcare? But we will probably get there.
Okay, sure.
And Bar is a leader, Bar Pereg, did I say correctly? Bar is a leader in innovation, social impact, focusing on using tech for urgent human needs.
Yes, sir.
From New York City.
Right on.
All right. And by the end of this panel, you'll understand real ways that tech is changing health and fighting poverty now, and the ethical challenges and how to handle them, and where to innovate boldly and where to be careful. And finally, what's next for tech for good? Not a little task for us. So, both of you, can you each share one specific example where tech is already making a big difference in area like health and humanitarian relief? And what new possibilities does it open to the rest of the world?
Take it away.
Ladies first.
Come on.
Right on. So if the question is what is already is example for this is working, it's really easy to go to the topic of mobile banking, right? So in Africa and Kenya specifically, 90% of people did not have access to any financial services. Now that sounds really like basic, but it means that people cannot save, cannot loan, cannot send their kids to school, cannot have insurance. The introduction of mobile banking, way before it was popular here, opened the gate for banking for 90% of people. And that made a transformation in the economy. It has been studied that the direct impact of mobile banking uplifted 2% of Kenya from extreme poverty. And extreme poverty, by the international guides, is $2 a day, right? So lifting 1 million people from extreme poverty by introduction of mobile banking, right? That's kind of what is possible and what is not yet happening in so many areas, which I'm sure we're going to talk about.
And Bar, I want to follow up because where do you see the tech's wasted potential in today? Because you mentioned a large area today, and we debated this earlier, so you're opinionated.
I am.
While you do that, I'm just going to check out the time because it's, you go ahead.
Yeah, okay. So let's do a quick of a check, because I think the big waste is technology does not support humans exercise their being human. So we have a bit of a group there. In a show of hand, how many of you are using an Amazon or kind of like a digital delivery service?
Anyone using Amazon here?
Pretty much everyone. Fair. Okay.
Shocking news.
How many of you using mobile banking like you do? Okay, all of you. How many of you are managing your donation portfolio so you can see where you donated money and the impact it made in the world?
I donated
no one. Right on, dude. So basically, it's the same things, right? But we're unable to know how we're making the world a better place. We don't know how to send money to where needed the most at the right place. And why not, right? We already know how to do this, right? So our portfolio companies are doing exactly that, trying to find ways to make the world better with existing technology. And one of our portfolio company, by the way, just for this to be different next year, Bono.so, they help you manage your donation portfolio. So the revolution is starting.
Okay.
I might pick it up, and I want to move over to healthcare and life science, because it's a really pressing issue, and it affects all of us. All of us want to improve our health. All of us care about our health. But usually when I speak in front of audiences, I'm speaking in front of people who are passionate and engaged with healthcare and life science innovation. Anyone here involved with healthcare or life science innovation? Fantastic.
Some people there.
Some people over there as well. So it doesn't matter how you approach healthcare or life science innovation, whether you're a clinician or a big tech like Amazon Web Services, or a big pharma, a hospital, or you're a VC, a venture capitalist. What I always say is that we have one job to get done. Just one. All of us are doing the same thing. And that's, we are shortening time to clinical value. And that's the promise that technology can bring.
What does that mean?
So now it takes around 10 years to develop a new drug. Okay? That's a long time. And there are a lot of what's known as rare or orphan diseases out there. So these are diseases that affect not so many people. But if it's your child, you actually don't care that it's called a rare or an orphan disease. You just want a solution. So imagine if we all got together, and the technologists and the clinicians and the pharma and the VCs, and we made that 10 years into 5 years. That's 5 years of people with a diagnosis that may have some hope. And that's why I get out of bed every morning. And you were going to ask what's Amazon and healthcare? Because, Bar asked about Amazon, but did anyone know that Amazon or AWS, where I work, the cloud business, is involved with healthcare? Anyone know about that? Yeah, one or two.
Is it because Bezos wants to live forever?
I can't comment on that, but what I can say is the cloud business at Amazon, it's a very large business where we help organizations of all sizes. I particularly work with startups, use compute and AI tools to develop the magic that they do. So we have a very specialized team focused on helping those startups get their job done. And I want to come back to your first question. Where is this working? Imagine a scene Friday night at 3 a.m. at an emergency ward. And there's all sorts of things happening on a Friday night in a big town, and lots of people come in, 30, 40 people with all sorts of injuries. How do you know who to treat first? How do you know? Now, in the old days, you have a system called triage. A nurse will come and interview, you might do some scans. This thing can take a long, long time. Now, if you've got some bleeding in your brain, every minute counts, every single minute. What we do now is that immediately everyone's scanned, and then AI, using the cloud, can provide that nurse and those doctors the priority list. You need to treat this person first. And there's this other person with a broken arm. As much as they're in pain, their life isn't in danger. We can treat them seventh. This is stuff that's happening now, and it's saving lives.
Okay, sounds glorious, but in practice, I would love to see if it works, because there's a lot of this happening. Well, we'll get to that, because I like to challenge my panelists.
Sure.
Bar, the digital divide, this incredibly sexy word that we've been throwing around a lot, means that not everyone has access to tech. Now, how does this affect benefits from technology to the rest of the world?
Yeah.
By the way, hello.
Hello, son.
Guys, it's kind of dry over here. Like, if you want to, come over.
It's really wet there, so wet bums are not sexy.
I tried.
But yeah, digital divide.
The digital divide means different things to different people. So I'll just frame it for a second as the concept of some people, some systems, some companies are able to use and leverage technology or digital tools, and some are not, right? And this divide means basically that we are not improving human condition, we are exacerbating equities, right? So the way we think about it at Polylabs is that our system that are digitized, right? Like Netflix is really well versed in digital, so they know me so well, they can really help me guide my next binge. Or Instagram will help me do my next spring cleaning because they know me, so they can benefit from the business of digital. On the flip side, let's take humanitarian supply chains, right? The business of taking care of the most vulnerable people in the world after a disaster or a war. These are not very digital systems. And as a result, the efficiency and effectiveness is just unacceptable, right? So we are literally wasting money, dollar donated for kids in need, and we need to spend it on coordination and on things that technology have already solved. So the digital divide is really, for us, the gap and the opportunity that we all need to lean in to make sure that technology is not just serving the, yes, Guy?
Get in there.
Yeah,
Bring it.
Yeah, I wanted to pick up on the digital divide, because we used to talk about it a lot, and we still do talk about it, about people who know how to use technology and don't know how to use technology. In my view, the digital divide is that people who know how to create technology and people who don't know how to create technology. Because that really, if you know how to create technology, you're going to be improving your access to so many things, you're going to be improving your wealth. With Gen AI and with the the foundation models that are out there and the Gen AI revolution that we're living through, there is an incredible opportunity for many more people to be engaged in creating technology. And I actually am very hopeful. And if I think about it in the healthcare, I think it's going to be fantastic. We're going to see nurses and doctors creating tools to help them do their own work rather than being scared of something AI coming to take over.
Hold on. That seems like there's more people has access to my data. Because who sees my data now? The more you just mentioned a lot of chains of people.
Yep.
That means a lot of random nurse who just can see my data, and I'm a sensitive flower. I don't want everyone to see my data.
So first of all, the nurse that's looking after you, you want her to see your data, right? She has to know the parameters, what medicine to give you, the kind of dosage. She can't do that without access to data. But more than that, we need healthcare data available for the researchers and innovators. And when you speak to patients and survey them, more than 90% are willing to give their data for research and innovation. It's for everyone here, if we go back 20 years, it's like donating blood, right? We donate blood to help not ourselves, but to help our community. So when you're giving your data, and of course it's going to be anonymized or pseudonymized, but when you're allowing access to that data to the researchers, when I said before about taking 10 years to 5 years, that's exactly the thing that's going to help us bring down the time to bring that new drug to market.
One thing to build on the data piece, because I think it's really important and it's taking a lot of space of the conversation, right? So let's think about really successful products, consumer goods, right? So Procter & Gamble is very successful in getting me to choose a specific cleaning product. Why are they doing this? Because they have deep data and understanding of what will make me choose a specific softener, right? They have user data that they analyze to drive behavior change. Now, if we want to drive behavior change, get people to stop smoking or put seatbelt or use crop insurance to make sure that they are better farmers, we must have data so we can change behavior. Now, we must be super careful and humble about the unintended consequences of having data and changing behavior, but there is no way around this. So we really need to have this conversation openly and repeatedly, because that is how we're changing behaviors and making an impact.
Okay. We mentioned a lot, when we hear it everywhere here, generative AI is a huge topic. I'm frankly quite tired of hearing it, but can you give one concrete example of how it's improving healthcare today?
Sure, absolutely. So the killer app in healthcare, in digital health today, is something called ambient listening. Do people know what ambient listening is?
Ambient
listening. So try and remember the last time you went to a doctor.
Yeah.
Okay? I'm going to guess that you were telling them about what's going on and bringing some sort of complaint. And the doctor was probably, let's say I'm the doctor and you're telling me your complaint. Probably the situation was like, oh, okay, so tell me about your complaint. And then he looks at the computer, or she looks at the computer and starts typing.
Yeah, they type while they actually...
And they're not actually listening in depth. So what ambient listening is, and this is taken on like wildfire, is you have a device that listens to the conversation between the clinician and the patient. And so no longer the doctor has to worry about filling in their medical record.
Oh, okay.
It summarizes the conversation, puts everything inside the medical record. It doesn't send the medical record because the doctor does have to approve it at the end, but they're much more engaged. And it reduces, so there are two main benefits. The patient feels like they're getting more personal human attention, and the doctor gets to reduce what's known in the business as pajama time. Does everyone know what pajama time is?
Pajama time?
Yeah. So doctors have such administrative burdens that they put it aside to see more and more patients, and then they put their kids to bed and they spend 2 hours in their pajamas updating the medical record.
Oh, really?
It's very common practice, especially with junior doctors. And what ambient listening is doing is it's getting rid of that. So doctors love it, and it's had the biggest uptake of any digital health tool that's focused on clinicians than any other that came before it, all in the last year and a half.
That's really nice, because I live in Netherlands, and I think my Dutch doctor will still give me paracetamol for my broken shoulder.
Oh, 100%.
It doesn't
I
matter.
also live in the Netherlands. It's
Paracetamol.
like,
whatever it is. Okay, moving on to a little bit call to action areas for you. to truly make tech serve humanity, which is your passion. I know you're fired up for that. What are the most important actions or collaborations we need to focus in the area of poverty, for example, and general tech?
Right, that's a great question. So, Guy was talking about how it's easier to create technology, right? It's cheaper because you have AI and you have all this data and you have etc. What we need on the other side of it is adoption, right? We need people buying products. We need people investing in products. We need people to engage in this arena of using tech for good because the creation is easier and people are creating, right? What we really are passionate about is finding ways to use what already exists, right? So we are working on repurposing technology for good. The idea that we can use existing technologies that were already developed and deployed by other sectors to solve other problems that have not been addressed before. So really, our call for action is identify what already exists and can be reapplied. Really find those opportunities to engage in the way that you consume technology, in the way that you make investment, in the way that you make donation to encourage the creation of such technologies.
What do you want to tap into that? Because I think
Yeah, I mean, I'm a big fan of Polylabs. I think what you're doing is fantastic. And there's, in the pharmaceutical, in the life science industry, we also have a repurposing kind of system where we take existing drugs and then we find out, can it be used on different population groups or for different disease areas? So the most famous example, and everyone has a giggle, is Viagra, which started out as a cardiovascular medicine. And then the patients were reporting to their doctor, hey, doc, something else is happening here, right? And then it became Viagra, right, that everyone obviously knows about. But more seriously, the literally billions, if not trillions of dollars that go into drug development and discovery, so many drugs don't make it to market. And now I'm going to try and tie everything together. What is happening today is that using AI and using agentic tools, so tools that know how to go and do research on their own and report back to the researcher, we are going through now, the industry, using cloud by AWS and others, and looking at all the data from all the old clinical trials, understanding maybe there are certain population groups with certain biomarkers and DNA with this failed drug, actually it worked for them. And we can then bring that back to life because all the safety has been done, all the checks have been done, and we can say, well, if you have this type of cancer, and it could be something like adenoid cystic carcinoma, something of the throat, another rare disease. But if you have a certain pathway that's activated and we can then check that, then we've now got a drug that we know that works for a certain group of population. And all we need to do is test for that particular pathway or that DNA. And here we go. We have a drug that can work and that we can immediately implement.
Which is so much cheaper and faster to market, right?
That's
like
right.
you're making it so much more economic and available and accessible.
And this is the power now of the cloud and AI. This is the power that we have to actually take all this wealth of data, understand what's in there, and then personalize our medicine for the future.
Let's go quickly. We have 50 seconds, and I love asking this no matter what panel I do. It's 2050. How does the world look like?
Oh, here's my optimistic view. Imagine TikTok power level of human interaction being used to prevent suicide. Imagine like Amazon type of getting you to engage in buying and getting you to donate and to really enjoy from being a good person. Like imagine this level of sophistication powering your other side of being.
Very optimistic.
So in healthcare, I think we're going to be in a situation where diagnosis happens in your home, and that the drugs or that you need, if it's drugs that you need, are personalized to your DNA, to your lifestyle, and it's kind of just all automatic. Think Prime, but just for personalized.
Is that where Amazon is going?
Amazon is, and AWS particularly, we're supporting our customers. We're supporting the startups that are innovating, the pharma that's innovating, the hospitals that are innovating, and we're making sure we're building the infrastructure and the support and the teams to empower those scientists and innovate what they do. And that's what we're committed to doing. And if you are working on anything in healthcare or life science innovation, I'd love to speak to you and see if we can help you out.
Thank you very much. It was a pleasure and the sun came out. So thank you very much.
Thanks, everyone.
Thank you.